Schistosomiasis, also known as bilharzia or snail fever, is a neglected tropical disease that affects millions worldwide. This debilitating condition is caused by parasitic worms called schistosomes. These parasites thrive in freshwater environments, particularly in tropical and subtropical regions. The disease was first identified in Egypt in 1851 by a German physician named Theodor Bilharz, hence the alternative name, bilharzia. Schistosomiasis remains a significant public health concern, particularly in developing countries with limited access to clean water and sanitation. Schistosomiasis is often called a silent disease because its early symptoms can be mild and easily overlooked. However, without proper treatment, the infection can lead to chronic health problems, including liver damage, bladder cancer, and infertility. Children are especially vulnerable to the long-term consequences of schistosomiasis, which can hinder their growth and development, impacting their education and future prospects. Schistosomiasis is caused by several species of parasitic flatworms belonging to the genus Schistosoma. Humans become infected when they come into contact with fresh water contaminated with the larval form of the parasite known as cercariae. These microscopic cercaria are released from infected freshwater snails, which serve as intermediate hosts for the parasite. When these cercariae penetrate human skin, they transform into another larval stage called schistosomuli. These schistosomuli then travel through the bloodstream to various organs, including the liver, intestines, and bladder, where they mature into adult worms. The adult worms live within the blood vessels of these organs, where they reproduce and lay eggs. These eggs are responsible for the majority of the symptoms and long-term complications associated with schistosomiasis. The life cycle of schistosoma parasites is complex and involves both human and snail hosts. It begins when eggs released by adult worms in the human body pass out through urine or feces and contaminate freshwater sources. In water, these eggs hatch, releasing free-swimming larvae called miracidia. Miracidia then infect specific species of freshwater snails, penetrating their soft tissues. Inside the snail, the miracidia undergo asexual reproduction, producing numerous cercariae. These cercariae are released from the snail back into the water, where they can survive for a short period, actively searching for a human host. Upon contact with human skin, cercariae penetrate the skin and transform into schistosomuli, continuing the cycle. Understanding this intricate life cycle is crucial for developing effective control strategies for schistosomiasis. From itch to illness, recognizing the symptoms. The symptoms of schistosomiasis vary depending on the stage of infection and the species of schistosoma involved. Early infection may cause a localized skin reaction called swimmer's itch at the site where cercariae penetrate the skin. This reaction is often mild and disappears within a few days. As the parasite migrates through the body, individuals may experience acute symptoms such as fever, chills, cough, muscle aches, and abdominal pain. However, many people with schistosomiasis do not experience noticeable symptoms in the early stages of the infection. It is the long-term consequences of chronic schistosomiasis that pose the most significant health risks. These can include damage to the liver, intestines, bladder, and kidneys, leading to complications such as liver fibrosis, portal hypertension, bladder cancer, and kidney failure. Fighting back treatment and its challenges. The mainstay of schistosomiasis treatment is a medication called praziquantel. Praziquantel is an effective anti-parasitic drug that kills adult schistosomes. It is usually administered in a single oral dose, making it a relatively simple and convenient treatment option. However, praziquantel does not kill the immature forms of the parasite, so repeated treatment may be necessary to prevent reinfection. Despite the availability of praziquantel, schistosomiasis treatment faces several challenges, particularly in resource-limited settings. These include limited access to healthcare facilities, inadequate supply of praziquantel, and poor sanitation and hygiene practices that contribute to ongoing transmission. Furthermore, praziquantel can cause side effects such as abdominal pain, dizziness, and headache, although these are usually mild and temporary. breaking the cycle prevention and the hope for a future without schistosomiasis. Preventing schistosomiasis requires a multi-pronged approach that addresses both human behavior and environmental factors. Key prevention strategies include improved sanitation and hygiene. Providing access to safe water sources and proper sanitation facilities can significantly reduce contamination of fresh water with schistosoma eggs. Snail control, reducing snail populations in endemic areas through environmental modification or the use of molluscicides can help break the parasite's life cycle. Health education, educating communities about the risks of schistosomiasis and how to prevent infection through safe water practices, and avoiding contact with contaminated water is crucial. Despite these efforts, reinfection remains a significant challenge, particularly in areas with ongoing transmission. Therefore, researchers are actively working to develop a vaccine against schistosomiasis. A vaccine would provide long-lasting protection and could be a game-changer in the fight against this debilitating disease. A global call to action, raising awareness and investing in solutions. Schistosomiasis is a preventable and treatable disease. However, it continues to plague millions of people in developing countries, trapping them in a cycle of poverty and ill health. Raising awareness about schistosomiasis, particularly among policymakers, healthcare providers, and affected communities, is paramount. Increased investment in research, improved sanitation infrastructure, and accessible healthcare are crucial to controlling and eventually eliminating this neglected tropical disease. By working together, we can break the cycle of schistosomiasis and create a healthier and brighter future for those living at risk of this silent but devastating disease.